I'm Tom Blattner, and I'm the founder and president of JANUS Solutions, and we are a long-time human service consulting firm in New Jersey, and we are really pleased to be able to present the human service needs assessment to you and a plan of action with recommendations. What I'd like to say right from the beginning is that I'd like to thank the Freeholder Director and Freeholder James for giving your time to Dr. Linderman and for stating that you're not interested in having a needs assessment that's a pretty piece of paper that sits on a shelf, but you're looking for some action. And I want to say to Mr. DeNova, from the first time we met, he made that point. And so the idea behind this needs assessment is not necessarily to produce a good report, which I think we have, we've done. We have a good report that we've handed in for the final review. But much more importantly, that this is hopefully going to be the basis for positive action moving ahead. So I want to thank everybody for your support and really your insistence that this be a basis for action. Next slide. So basically, in terms of the way we did the needs assessment, we have a framework that we've developed over a number of years that we've used in a number of communities around the state, because it's really sort of hard to wrap your head around, human services and human needs and everything. So we've developed a very basic framework that looks at the journeys that people take in their lives from really before they're born to the end of life. And we've broken it down into stages of early childhood, positive youth development, transitions to adulthood, productive adulthood, and successful aging. So it's a very simple way to understand sort of the life journey. And then through a lot of highfalutin research, but more importantly, with a lot of conversations with parents and individuals in the community, we've arrived on a framework that says there are basically 4 pillars that we all need to have some mix in place to have a decent chance at a good life. And those pillars are financial security and personal safety, family relationships and community connections, health and well-being, and learning and education. So we use this framework as we went through this whole needs assessment process. And then the other thing we did, in addition to looking at the conditions of folks in the community, is that we were looking at the delivery system itself in terms of the organization of services. Can residents figure out how they find what they need? Can they navigate it with ease? Is it clear about where they're supposed to go for help, et cetera, et cetera, et cetera? So we looked at both the conditions of residents and also the way that services are organized. And our methodology is pretty straightforward. We did a massive data collection about Passaic County and organized it, dumped it into this framework. And then we had, and part of our methodology is not just to have data, but more importantly, have a lot of people from the community participate in this. And I think that if we had thought when the COVID hit that we would end up with almost 27,000 residents participate in one way or another in this process, I would have said, impossible. But one of the aspects of our work is to not only identify the problems and the issues, but to identify the strengths. And what came out of this process in the very difficult times was the strength and the interest and the commitment of people from all over the county, up county, Patterson, Passaic, Clifton. In the surveys, we all got almost 2,500 surveys, focus groups. The freeholders graciously gave some of your time. And one of the strengths we've identified, which will be a theme of this presentation and the name of the presentation, is community mobilization for collective impact, because our major finding, in addition to what I'm going to go through in terms of the data and everything, was that the entire Passaic County community stands ready to do something, and they stand ready at a very difficult time in our history. So I want to just make that point, and I'll make it over and over again. Next slide, please. So in terms of the big picture, the key issues that kept coming up over and over again: housing and homelessness, and we'll talk more about that, poverty and income disparities, and we'll talk about that, and then the opioid epidemic. Those were the 3 major substantive issues that have come up through the needs assessment. And then in terms of looking at the way that things are organized, there is a lack of information and access to services that residents have expressed. It's not in one place. It's not easy to find. There are a lot of resources out there, but nobody knows exactly how to get to them. That most of the services are reactive in the sense that they're organized around reacting to crises, and there's been little attention to proactive planning that will begin to bend the curve towards prevention and the success of residents. The services are out there, but they're fragmented. In some areas, there are gaps in service, or up county, for example, is an example of that. And throughout the county, there are racial and ethnic inequalities. And just a single statistic that I'll mention is for non-Hispanic white median household income, 90,477. For Black families, 41,745, and for Hispanic families, 45,812. So the racial and ethnic inequalities came up over and over again, both in the data and community voice. Next slide, please. So what I'm going to very quickly go through each of these pillars and just give you an overview, starting with homelessness. And as I mentioned, homelessness in the surveys and all the conversations we had with residents and in the data is popped up as the #1 challenge for residents in the county. And we're going to be spending some time at the end of the presentation on that. So I'll move along to the next slide. In terms of financial security, as I mentioned, there are big income gaps. There are a lot of people who are doing really well, but because of the people who aren't doing well, there's a big gap between the median household income and the cost of living in the county. So we have made two general recommendations here. One is that there are a lot of benefits out there that people are not taking advantage of. And so one of our recommendations is to make sure that people are aware of what benefits they're eligible for, and how do we reach out to them and get them to sign up, because it's a shame right now that people aren't taking full advantage of all the benefits that they can access. But beyond that, we're recommending a financial recovery and empowerment initiative so that people begin to move towards self-sufficiency. And this was a cry that came up in every single one of the resident interactions was, yeah, we need to have some basic needs met, but we need to start moving towards financial empowerment so that in terms of jobs and entrepreneurship and access to financial planning and homeowner programs, that there's a real need to start working towards financial self-sufficiency. Next slide, please. In terms of safety, this came up both in the data and the input from the communities, and so our recommendations involve bringing neighborhood assessments and safety and crime issues to the communities through crime mapping, to continue to look at the racial and ethnic inequities, particularly the overrepresentation in the juvenile justice system, and the need for more trauma-informed practices to serve youth, particularly opportunity youth, or those kids who are 16 to 24, who, if we don't get them support and get them into the mainstream now, we're going to lose them. Continued focus on prisoner reentry, and well, I mentioned opportunity youth. I'm sorry to be going through these so quickly. We have the report will be available to you, and of course, we're available for any questions that you might have tonight and going forward. Next slide, please. The biggest issue that popped up in family relationships and community connections was the inability of a lot of people to be able to get around, and seniors and families who are living in the suburbs and trying to get their kids to school when they can go to school and get to work. There were a lot of issues around transportation, and so we have made some recommendations here, which again I'm not going to go into detail now, but I'll talk to you about how we're going to deal with all these recommendations as we go forward. And then, of course, with the COVID, is to develop and expand teleservices so that people don't have to travel. And it's so impersonal and difficult to deal with, as we've just experienced, but it is the new normal, I'm afraid, for a while. Next slide. The other issue under family relationships and community connections is that people just can't, they don't know where to go to get help. And so we're recommending that there be a very simple, inexpensive way to catalog all the resources out there, how to get the word out to residents, and how can they access them. And then in terms of people who have language issues, that we make sure that this information is available in all languages, and to mobilize all the people out in the community, the faith-based community, the CBOs, et cetera, so that there's a collective effort to get this information out to residents and be supportive of their getting what they need. Next slide. In terms of gaps of services, one of the issues that's come up is that there's a shortage of services up county. There was a lot of concern about mental health services for kids. The language issue has come up again. So one of the recommendations which we're making is to develop comprehensive place-based approaches to service provision, so that we're looking at all the communities, because we did look at all the communities, not just the urban communities, and make sure that up county and Clifton, and in addition to Passaic and Patterson, have organized services available to their residents. And again, the language issue came up here. Next slide, please. In health and well-being, there were two big issues that came up in addition to obviously the COVID crisis, which is the big health issue at the moment. But the opioid crisis, in terms of the continuing increase in overdoses, is a major issue that comes up both in the data and people giving their input. And one of the biggest things that comes up here is that the services and the way that the policy and sort of approach is developed, it's organized. It's all organized around what happens when people get into trouble, which obviously is important, and we have to have an organized system in response to people who are already experiencing opioid addiction. But beyond that, there's a real interest, and I think a real need, to move beyond crisis intervention and make sure that there's aftercare available, but also that there are strategies in the community for prevention and early intervention, so that family members and people who are beginning to experience problems know where to go and know where to look and have access to services that can avoid so many tragedies. In the area of prenatal care, there are still babies who are being born without prenatal care, and there are many families who don't have health insurance. So again, we've made some recommendations here in the full report, which again, I'll mention how we are recommending to deal with these individual recommendations. Next slide. In learning and education, one of the issues that came up pre-COVID, but is now a real crisis, not only in Passaic County, but around the state and the country, is this whole issue of the availability of childcare. Particularly as people are trying to go back to work and they don't know what they're going to do with their kids. And so we have recognized this as a major challenge. And you have a child care resource and referral agency in the county, and we have some suggestions about how we can step up and meet the challenge of the child care crisis, particularly in this time of COVID. And then in terms of the high school graduation rates, again, things are getting better, but they're not where they need to be. And there are a lot of suggestions about collaborative efforts between schools and service providers in the community, and a variety of other potential collaborations that help kids in school do well and move into adulthood in a successful fashion. Next slide. So in terms of looking at the overall systemic challenges and opportunities, as I mentioned, the name of our report is Community Mobilization for Collective Impact. And that implies two things. The first is that people in the community are interested in doing something about these issues. And what I can tell you, resoundingly from everybody we talk to, from the public sector to the elected officials to, people who are, living out in various communities and around the county, people who are in health and mental health and education. And we have, in our final report, we have a list of all the people who participated in the steering committee. There was a resounding, and I would say from our experience, unusually high level of interest in people coming together to take these issues on. As a matter of fact, there was a feeling like if we're not going to do it now, we're never going to do it. And we heard that over and over and over again. So when we call for community mobilization, we wouldn't do that unless we were very, very convinced that the entire Passaic County community is ready to jump into these issues in a different way. And then the second issue is collective impact. And that is that none of these issues, if you look at the opioid crisis or housing or some of these issues around poverty or mental health, there isn't any one organization or level of government or nonprofit organization or sector that can take these issues on alone, but it's going to take everybody working together in a different fashion with targeted collaboration to improve some of these outcomes that we've uncovered. And again, in addition to people being ready to take on the issues, we found that they're ready to take on these issues together. And everybody wants to begin to move from this reactive crisis-based, fund things based upon the silo of funding it comes out of, into moving more into organized systems of service that support people in doing as well as possible in their lives. And then again, the issue of racial and ethnic equality came up over and over again. And so our recommendation is in all the planning and funding and representation we ought to do, that this needs to be, a major area of concern and focus and action. Next slide, please. So in order to mobilize the community for collective impact, we're recommending that the county create a Passaic County Collective Impact Council that would be comprised of public and private sector folks, nonprofits, community representatives. Certainly it'll be the people who volunteered on the steering committee could transition very nicely into this Collective Impact Council, make sure the municipalities are involved. There were some state folks who were involved in this process, but basically we're recommending that the county establish a Collective Impact Council to map out and implement strategies and systemic solutions to all these issues that we've raised, and that this council would take all these recommendations we've made and the findings we've made and make priorities out of them, because you can't take everything out at the same time. But this would be a way of the entire community coming together to focus on improving the outcomes in the life of residents in the county. And in support of that, we're also recommending, because a lot of these issues go across departments and different sectors of county government, that we're recommending a collective impact council inside of county government to make sure that all the departments and sectors of the county government are supporting the work of the Passaic County Collective Impact Council. And then finally is that we've been supporting the Department of Human Services to improve its operations and its image in the community, with tremendous response out in the community. So we're recommending that momentum be continued and built upon. So that's basically, in a very, very cursory fashion, what we did, what we found, what we're recommending. But I think that the most hopeful aspect of this in a very, very dark time is the interest and the willingness and almost the people crying out to get together and start moving together to tackle some of these issues. So as I mentioned, the number one issue that came up is the issue of homelessness. And with winter coming on, there's a lot of urgency to it, and everybody felt that urgency. So what we're recommending is that the first area that this collective impact approach be applied to is the issue of homelessness. So I'd like to now turn over to Dr. Linderman to walk us through our thinking and recommendations around how, through collective impact and community mobilization, we can make a dent into the homeless issue. Albert?
Yes. Thank you, Tom. The approach of wanting to address homelessness automatically relates to addressing housing. And housing issues in Passaic County are under some pressure in certain areas. We'll look at some statistics here. Next slide, please. You see some of the background on the housing issue. It's possible difficult for some of you to read all of this, but just to briefly summarize that we are in a plan to end homelessness that is now 12 years old. It was established 12 years ago, intending to be 10 years in length. Unfortunately, there's some reasons, perhaps a lack of a real addressing of the complexity of the issue, because homelessness and housing are quite complex and involve multiple players and factors. So the need of homelessness and the initiative and the attention that we are recommending needs to be given immediately also includes an attention to affordable housing. So the two areas that are most difficult in Passaic County are Patterson and Passaic City. If there's one study with the 365 communities in the nation, Patterson is fifth from the bottom in terms of the percent of income that its residents are spending on housing, and Passaic City is last in the nation, meaning the highest percent of the residents' income is being spent on housing. Next slide, please. We have homelessness growing in numbers over the last number of years. Our last point in time count was January of this year. So since the beginning of the pandemic, the numbers are likely higher than what you see on this slide. We also are aware that many landlords have filed notice of eviction that are all currently on hold till the end of November. But if they were all allowed to go through and the numbers of persons who are under eviction notices were in fact released into the system, at this point there are around 4,000 individuals that are in danger of that in Passaic County alone. So as Tom mentioned on more than one occasion, there is very strong a spirit of collaboration for addressing this, and knowing that not any one entity can of itself solve the issues, because if we could, we already would have. So as we decide to address something as dramatic as this, it's going to take all of us. Next slide, please. So immediately, there are some actions that can be taken that will start to address the challenges in homelessness and housing. We need an increased capacity of leadership in this area. So there's been some excellent work done in the county. It's not like there's nothing good going on around housing and homelessness. There are, but it's not coordinated. The players aren't in the room together or in the virtual room together, understanding from their various perspectives and determining appropriate steps that are going to shift the system so that long-term we don't see the growth that we've seen over the last decade, but we can see a reduction because of how the system has shifted. You see that some certain specifics that are listed here under the immediate approach. There are some things that can be done, and not only ideas that have been presented, but also some initiatives that have been begun. The city of Patterson has Project Hope out of the mayor's office that has identified a number of short-term areas that can make a difference, at least in a small way, in addressing homelessness and then the need for affordable housing. The collective impact side, that's where this collective impact council is going to make a significant difference in the long-term outcomes that we can expect to see. One person's description of systems, Lewis Thomas, he said, when we're confronted by any complex social system, whether that's a city or a county, And with things that we are anxious to fix, you cannot step in and set about fixing with much hope of helping. You cannot meddle with one part of the system from the outside without the almost certain risk of setting off disastrous events you had not counted on. If you want to fix something, you are first obligated to understand the whole system. Intervening is a way of causing trouble. And so this is the benefit of a collective impact approach and the idea of a collective impact council, and particularly a homeless initiative addressing the needs of homelessness and housing. If we shine light from every angle of this community, from the nonprofit world, from government perspective, from business perspective, from the faith community's perspective, and from the citizens who are experiencing the challenges and are teetering on the edge of homelessness, as we see light from every angle, together, we can begin to see the whole system in ways we've not seen it before and make the kinds of intelligent shifts that long-term are going to make a difference, that being the whole idea of this collective impact council. Next slide, please. And so part of our process of initiating systemic change is this public community partnership, this collective impact council to create a homelessness task force that will focus on the designing and implementing of an organized system of services and supports, both short and long-term solutions, and tracking the implementation of this approach. And so now I'll turn it back over to Jeff Pursley.
Thank you, Albert. Could I have the next slide, please? So just in summary, what we've talked about tonight and what we've presented to you focuses on the next, or leads to the next steps that we're proposing to take. The first is to create that collective impact council that was being discussed and create the collective impact cabinet of county officials. And the first step is the initial project to address homelessness. And we have a pretty significant schedule right now. The outreach to potential partners in this effort will be done by this week. And we're going to convene the homelessness task force by the end of this month. We are issuing an RFP for case management and individual support services tomorrow. And we plan to have services in place no later than the 1st of November. So are there any, next slide, questions and discussion?